my screen again. Great. So thank you again, everyone, for being here. We're very excited to be talking about this important topic with you today. My name is Amherst Kinney, and I'm the Director of Research at Neighborhood Villages, and I'd like to begin by introducing our esteemed panelists. Gina Adams is a Senior Fellow in the Labor, Human Resources, and Population Center at the Urban Institute. Her primary focus over her career has been on the broad range of policies and programs that affect the affordability, quality, and supply of early education and childcare, and factors that affect the ability of families with lower incomes to access and participate in these services. More recently, she has focused on many issues in this space, including assessing childcare subsidy policy through an equity lens, exploring strategies to support the supply of care, parents' perspectives on non-traditional hour childcare, barriers for home-based providers in accessing public funding, and examining the broad range of supports that are needed to stabilize children and families. Next, we have Dr. Teresa Hawley, the Executive Director of the Center for Early Learning Funding Equity at Northern Illinois University. Dr. Hawley is an expert in early childhood programs and systems that support the school readiness and social competence of young children in poverty. Dr. Hawley has served in many roles in Illinois throughout the early childhood system. One example, from 2017 to 2019, she was Senior Vice President for Policy and Innovation at Illinois Action for Children, where she led the agency's efforts to link together program research, public policy, and advocacy work. And I realized I should have advanced my slides, so apologies. Finally, Dorothy Williams has been working with families in the Dorchester neighborhood of Boston for the past 15 years. She is committed to creating an enriching environment that fosters the growth and development of all children. Through her formal education and ongoing training, she can support each child's unique skill set. In addition to being the current acting president of the Massachusetts Association for the Education of Young Children, Ms. Williams is a doctoral candidate at the University of Massachusetts, Boston, where she completed previous graduate studies in early childhood education. We are so grateful to have all of our expert panelists here today and look forward to hearing from them. I'm going to go ahead and start with some brief level setting about what it is exactly that we're talking about today. And then we're going to hear from our three experts who can contextualize provider participation a bit more. So when we refer to the subsidy system, we're talking about a federally supported program that provides financial support for families with low incomes who need care. The federal government allocates funds to states who meet certain requirements, and states can chip in too, as Massachusetts does, and make payments directly to providers who serve children with financial assistance. The provider payments are reimbursements, and the amount they are paid is the reimbursement rate. And so providers elect whether or not to participate in the subsidy system. And what we see here is that a little more than half choose to do so in Massachusetts. We know that the current child care system has insufficient capacity to serve all families with financial need. The number of children whose families meet eligibility requirements for financial assistance well exceeds the number of children who are enrolled with subsidies. And looking at participation amongst family childcare providers and group and school age center-based providers, we see a pattern that's consistent with overall participation. So just over half of each of the family childcare provider type and the center-based programs are participating in the subsidy system. But participation is not even across communities. We see that those communities with higher social vulnerability have a higher percentage of providers who participate. What this chart is showing us is the percent of providers who serve children with subsidies in Massachusetts by community level of social vulnerability. So social vulnerability refers to potential negative effects on communities caused by external stresses. The CDC considers 16 social factors, including poverty, and computes a percentile ranking in the range of 0 to 1. So you can see the tallest bar in this graph shows that about 78% of the providers in the communities with the highest social vulnerability serve children with subsidies, compared to about 26% of providers in areas with the lowest social vulnerability. So finally, what the data tell us is that we need more participants and more slots with existing participants in the subsidy system. In Massachusetts, around 16,000 eligible children are currently on the state's centralized waitlist. And providers range in the percent of children they take with subsidy. So relative to their capacity. So 23% of those providers taking subsidies fill up about a quarter of their roster or less with children with subsidies. And more than 4 in 10 providers who don't participate in the subsidy system are located in areas with high need. So hopefully that gives you a sense of the subsidy landscape in Massachusetts. And now it's my pleasure to turn it over to Gina Adams, who will share some of the considerations providers face when deciding about participation in the subsidy system.
Sorry about that. Hold on. I'm showing my screen again. There we go. And slideshow. Does that work for everybody? Can everyone see that well?
Yes.
Okay. Thanks so much, Amaris. This was really it was a great intro. Obviously, the limited funding is one of the primary drivers of all of the challenges we face. If we had more money, there would probably be more participation. But I think what I want to talk about a little bit is understanding the kinds of factors that we have to consider if we're trying to meet this goal of the session today, which is really around increasing provider participation in the subsidy system. So what I want to touch base on is what kinds of factors might shape whether or not they were willing. How might this play out across different kinds of providers? Which of these factors can we try to shape through policy, practice, or other kinds of supports? And what are some of the implications for action in Massachusetts and elsewhere? I just want to say briefly that this work, I think I'm sorry, kind of gave a little bit of a list of them, but it comes from a lot of different work that we have done over time at the Urban Institute, including work on providers, directly talking to providers and parents about their experiences with subsidies, a focus on home-based providers, particular interest around recently in families who need childcare during non-traditional hours and the providers who care for those kids. And then our most recent work, which was looking at the limitation of using subsidy rates as a tool to expand supply, which is one of the main policy tools that we tend to have. Now, all the source documents for this and links are on the last slide, so you can access any of these if you want to afterwards. So now the focus is usually when we think about what affects whether a provider is going to participate, since we come at this with a policy lens, the focus is usually the subsidy system and that's it. But what I want to do is kind of lay out subsidies as one of many factors. There's personal and professional considerations that come into play, financial considerations that come into play, and non-financial considerations come into play. And which of these factors come into play depends on what the provider, which provider, what kind of provider, and their circumstances. So I'm going to go into that a little bit more in depth. Now, there's a lot of words on this slide, so I'm just going to tell you briefly what's in it. And but basically, what my biggest point takeaway is we have to start by looking at the provider's perspective on this. We often come at things with a policymaker's perspective, and we think we know what they want, but providers have a lot of factors that shape their decision. This slide is basically divided into 3 chunks. So the top chunk is personal and professional considerations, and it's things like, do I feel comfortable providing this kind of care? Do I want to serve kids who are low income? Some providers say they really want to, and that's their motivation, and some providers really don't want to. What would it mean for the provider, for the children and families I serve now? What would it mean for my workload? Do I have to do additional things to be in the subsidy system? So these are the kinds of these are just a few examples of personal, professional kinds of factors that can shape whether or not a provider wants to become part of the subsidy system. Then there's financial considerations, like how much will it cost? For example, if you have to change your business model, you suddenly have to become licensed or be QRS rated, will I get paid enough to actually meet my costs in serving these kids? Can I count on getting paid? Is this a reliable funding stream? Can I count on there being enough kids needing this service to make it worth my while to join? Do I need to do this to be competitive or to stay afloat, or am I doing fine without it? So all of these kinds of factors are another set of issues that can affect the financial kinds of decisions that folks make. And then there's non-financial factors, which is how easy or hard would it be to do it? How easy is it to get paid? How much of the logistics? Would I have to meet additional requirements? Would people come and inspect me? How would they treat me? And if you look at all of these, you can see that different kinds of providers are going to see these in different ways, right? If you have a really strong demand of private pay parents, you might weigh these kinds of factors differently than if you were in a very community, as Amherst has said, with very high social vulnerability, with a lot of families who might need subsidies. So thinking through kind of who's going to be affected and how is one of the points that I want to make today. So let's talk about these a little bit more. So on the financial considerations, Teresa is going to talk a lot in a few minutes. Teresa Hawley is going to talk a lot in a few minutes about rates. But what I want to talk about is the context around rates that mean that they're not sufficient, which she's in great agreement with, as a tool by themselves. Because the level of the rate, what we always focus on is what's the level the rate set at a state. But it's really important to understand, first of all, that's a ceiling. That's the top the state will pay. It may not actually reflect how much the state will pay. So, for example, there's a number of policies and practices that can reduce the provider's payments to below that level. For many states, I'm not sure what you do in Massachusetts, they'll only pay the provider what they charge private paying parents. So if you're in a very low community with very low income and you can't charge high prices, the state won't pay you beyond what you're already charging parents as well, which kind of codifies market inequities that we have in place. Many states will not pay for common fees like registration fees, field trip fees, diaper fees, those kinds of issues that can really whittle away at the amount that a provider gets. There can be very unclear communication around when a child is authorized or terminated. So you can find providers who will serve a child for a few weeks and then discover later that they weren't authorized yet, so that was unpaid, or the child was terminated. Again, they served the child without being paid. Inaccuracies in payment, and if it's hard to resolve those, you can sometimes end up just losing money without being able to fix it. Again, these things have equity implications and they affect different providers differently. You can imagine a provider with a really good administrative staff might be able to work through all these payment problems, and a provider who's a family childcare provider working by themselves in their home may not be able to take the time to spend on the phone trying to figure this out. So I think the first point I want to make here is that it's really important to look at what providers are actually getting and how different providers may get different amounts, and not just focus on the rate. The rate is the first important thing, but beyond that, what do we know about what actually is happening? The next thing to recognize is that payment rates don't necessarily address other kinds of financial costs that can be associated with participation. There can be startup costs, as I mentioned, if you have to become licensed or meet QRS standards or something like that. There can be program costs if you're like trying to suddenly provide care for certain kinds of kids, that's non-traditional hours or whatever. That means changing your business model. You may, as Amherst just pointed out, you may only have a few kids in your program who are getting this. So is the amount of money you're getting for those few kids going to make it worth your while to change your overall approach? It's going to be very different for folks who are in communities where there's a lot of demand or where there's enough subsidy funds to know that if you have a slot open, seat open in your program, that somebody will be able to fill it? Or is there a waiting list? So if a kid leaves, you're not going to be able to fill that slot with another child with a subsidy. As you all know, I think voucher is, you have in Massachusetts both vouchers and contracts. Voucher payment approaches can be very unstable for providers, particularly if there's a waiting list and you can't be sure of filling that slot again. Subsidy-based contracts have their own challenges, which we don't need to get into here, but they are not necessarily the be-all and end-all solution either. But they do provide more stability. And I think finally on this point, I'd like to say is that the subsidy system is only a small part of a larger financial market that shapes the provider's financial incentives and their costs and their resources. And one of the big issues is the value and the cost of a subsidy really depends on who else the provider can serve. So they are weighing it. It's not just like this kid comes in. It's like, if I get this kid and the subsidy system pays less than I can get from this kid, Or is this a more reliable funding source than a private pay parent might be in that community? Those kinds of issues can play a role. Then there's all those non-financial and personal and professional considerations that I mentioned in the middle a few minutes ago. Again, these are hidden costs of participating, but paperwork, administrative burden, how easy or hard is the payment process? How easy or hard is it to resolve payment problems? Can you align, particularly if home-based providers can face, there's QRIS here and there's licensing there and there's CCDF here and, there's CACFP and child food program. I mean, there's different requirements requiring different things. It's not a question of deregulating, it's a question of aligning regulations and making sure that the compliance and focus on quality and safety is there, but that it's not driving folks nuts in the process. And then also a real issue, particularly for home-based providers, is it's so important to take a strengths-based approach to working with all provider types, because so often the home-based providers or providers in particularly low-income communities can be facing very different kinds of treatment from the state agency. So I think this here, it's really important to try to understand the non-financial reasons why providers may not want to participate and think through what you might be able to address. And then these are just some of the ways that different characteristics of providers can mean that all of these things play out differently. It can be setting type, the kind of service. Is it daytime, non-traditional hours? Is it big programs with administrative staff or smaller programs? How stable is the demand? What kind of local market are they in and what price can they charge families? Do they have a really good reason to not trust engaging with the public system? Do they have reasons to be fearful of folks coming into their homes? Do they face language or literacy barriers? Each of these issues have real equity implications, but thinking through how the system works and whether or not it's touching these issues and addressing these challenges is really important. So this is just a different version of the really good slide that Amherst mentioned about kind of how many folks are participating. But I just want to kind of, if I had been able to, I would have asked her to just give me her slide. But her point about that there's really different levels of participation is really important because all of those factors together go to shape who's participating, who's not. So this basically shows that in Pennsylvania, of those providers accepting subsidies, more than a quarter of the centers accepting subsidies had less than 10% of their kids on subsidies. And more than half had less than a quarter of their kids on subsidies. This is just an example that in their picture, it looks different, a little bit different from family childcare. But what I want to point out here is for you all to think about, there's all these people who are not participating at all and understanding why they may not be in a community that has any kids, right? Or they may not want to serve these kids, or they may not know how. But this low levels of participation, you don't know why that's there either. Again, is that a low incidence of kids community? Is that the system is just too hard and those are providers that can make other choices and they're going to, we talked to providers that I'll take 2% of my kids on subsidies and that's it. I tithe, they basically said. So thinking through who makes up these different levels of participation and why, and which providers you want to be encouraging allows you to think about how you're going to design your system. So in summary, basically how you would incentivize is first understand why providers do or don't participate. Look at how this plays out differently for different kinds of providers so that you can kind of identify your priorities and tailor your strategies. Really understand that raising participation means more than raising rates. And think about really developing kind of targeted strategies to address, tailored to address the constraints that you find. So these are the resources that I have. I know I went fast. I apologize. Somebody said, you never knew she grew up in Texas, would you? So anyway, I hope it wasn't too fast. But I know you're about to hear some great stuff from Teresa and Dorothy. So thanks so much.
Thank you so much. It was a lot of information and we really appreciate it. And now we'll turn it over to Dr. Hawley, who will tell us a bit more about the reimbursement rate and how that fits into the cost of care. Thank you.
There we go. Are y'all seeing the screen now? All right. So I'm going to share with you some information that we were fortunate enough to have a contract with the Massachusetts Department of Early Care and Education to look at the market rate. And for childcare, as well as what we call a narrow cost analysis. And I'm going to spend a little time talking through these terms and this way of thinking about the childcare market that kind of helps understand and put in context a lot of what Jeannie was just saying about the choices that providers make about who they're going to serve and how the subsidy program fits in with their overall set of services. So, and I am going to take this a little bit more from the policymaker's lens of how a state needs to think about setting its rates as part of an overall strategy to support greater access to early care and education for families throughout the state. And the federal government requires that the state look at its child care policies and set them in a way that maximizes access to the child care market for families who are using the subsidy system. And the most common way that people talk about this is that we look for rates being set at the 75th percentile of the market rate. That's the benchmark that the federal government is setting. And that really means that you're trying to set rates in a way that would allow parents then to have access to 75% of all slots that are out there, because their maximum price that you would pay is pegged to what the most expensive 75% of the market is. So that's one way of looking at the way that of looking at rates. A second way of looking at rates that I find also helpful, and that it's a little bit different, but it's important to do because you can kind of get them confused in your head and think differently. And that is to look at rates as a percentage of the benchmark price. And so what I'm saying here is, like, let's say that the 75th percentile is $50 a day for a preschool or something. And that's the 75th percentile, but the state is paying at $40 a day, which happens to be at the 35th percentile of the market. Well, that $40 is 80% of the target mark. So it's just a different way of thinking about how close are you to getting to that benchmark. It's sometimes easier to understand than the percentiles are. The third way that folks can think about how good a job the state is doing is the percentage of providers who actually do accept subsidy, because it's sort of the proof is in the pudding here. How many providers actually are accepting that subsidy? And all of those three factors together really come together to give you a good picture of how effective the state's policies are at providing access to the market for parents who are using the subsidy system. What I'm going to talk about today is really a little more about these, about the prices and the analyzing prices as a way of looking at the childcare market, and then analyzing costs that providers have as a way of looking at the market. Because as we think about how the state has put its childcare rates out there, these two things, prices and costs, are different lenses, different ways of looking at that for the state. And we did work for the state on both of these, and as most states are doing right now and are required to do by the federal government, is first looking at the price of childcare, the prices that providers are charging, and where our rates are in relative to what folks are charging in the private pay market. The second way is looking at costs. What does it actually cost providers to provide those services? Sometimes you would think, the price must be what it is costing the provider to provide that service, but sometimes not. Providers often supplement their parent tuition fees, their prices, with other resources, so their costs are actually higher than that. Sometimes it is a largely for-profit market, so sometimes the price that parents are paying is higher than the cost if all is going well for that for-profit provider. So prices and costs are kind of two pieces of information that the state wants to know to be able to understand how it's setting its rates so that it is providing access to the home market for families. Those two pieces of information, prices and cost, together help the state to understand how well the childcare market as a whole is functioning in that state or in any given region of the state. Why is this important? Because it's not just about whether the rate is equal to what parents would pay in that market. It's really about whether the total resources are going into that market are enough so that people are able to provide that service to families in a way that they're able to retain and recruit staff into their programs and pay them sufficiently. So a child care market is functioning well when providers are able to charge private pay families enough money to cover their full costs. That sort of makes sense, right? If you can't charge enough, then you're going to go out of business. And if that's the case, then subsidy rates should be focusing on making sure that parents have access to the largest portion of the market possible. But if the market is not functioning well, if providers, generally speaking, aren't able to charge parents a high enough fee to cover that cost, then just setting subsidy rates to match the market rates is not going to be enough to make the whole system work. And so these are the kind of things that we've been wrestling together with the department on to really think through how do we create a financing system for early care and ed that is going to support those families who are need subsidy to access the system, but also support a healthy child care market overall. One quick thing to keep in mind is I'm going to show you a little bit of data about the market rate prices and the costs. In most centers, it costs a whole heck of a lot more to serve infants than it does to serve preschoolers or school agers. We know there's a very steep curve here of cost, but most providers don't pass that steepness of a curve off to parents. Most providers do a loss leader with their infants and toddlers. They charge less than it costs them to provide the care for the infants and toddlers, and they charge more than it costs them to provide the care for those preschoolers and school agers. That's important when you're going to see a little bit of data here about, you'll see in particular where prices that are being charged for infants and toddlers in the market are often very much lower than what the costs are that we think that they'll have. Now, a context here to understand, we did some work this year on how the state was doing in terms of meeting the market rates, and you'll see that it's definitely not at the same context Massachusetts for quite falling below benchmark of market rates, and no doubt many of you know this. So what did we find out? Remember those three things we wanted to know, which were the rates as a percentile of the market rate. So the subsidies are below the 75th percentile in all areas of the Commonwealth, all regions, all age groups, and in most cases below the 50th percentile. So again, the reimbursement rate can only buy about half of the slots that are in the Commonwealth. And when we look at how much lower they are than the benchmark rate, they're 30 to 40% lower. That's quite a lot lower. So no doubt that folks who are getting the subsidy in many cases may be struggling with serving kids with have subsidy because they could charge so much more for parents who are in the private pay market. Nevertheless, about 60% of providers do report that they accept child care subsidies, as previously talked about. This slide here has a lot of information on it, but I think what the easiest thing to focus on is how much is red and how much is green. The red numbers here represent rates in a specific region of the state and for a certain age group and provider type that are less than the 50th percentile of the market rate. So again, rates that are as low as, here only about 21% of providers charge as little as the state pays for the reimbursement rate. And the green are ones where it's at least at 50 or above. So you can see that pattern where there are indeed a lot of places where the state's reimbursement rate is substantially lower than what the market is charging. I think it's also important to see that these numbers vary quite a lot. It is not a very consistent story all across the state. So in some places you may be getting close to that 50th percentile, where in other parts of the state you're substantially lower than that. This is not uncommon across states. That many states, and I think Massachusetts is like them, set their reimbursement rates years and years and years ago, and from there have been doing raising it by certain percentages across the board. And those kind of across the board increases over time end up with some distortions because the market itself is not just doing across the board increases. Things are changing all the time. And so there may need to be some rejiggering of rates across the system in order to get to a little bit greater equity. Again, we found that about 60% of providers do say that they accept the child care subsidy. Rates are certainly part of why some don't, but some of them report other things in line with what Gina was saying. 32% say, well, you know, we are already serving enough kids. We don't really need to have subsidy kids. Some are really saying, yes, it's about the subsidy reimbursement rate. Some are saying that the paperwork is really a challenge here. So lots of reasons that we found in our surveys of providers as part of our market rate survey of why they are or are not participating in the subsidy system. Just to give you a sense, how does this compare with other providers, or I mean, other states in the area? It's, again, not uncommon for states to be providing reimbursement rates that are below that target of the 75th percentile of the market rate. So just to give you a sense here that, you know, Massachusetts is in a similar company here with Connecticut, New Hampshire as having rates that are substantially below where the 75th percentile of the market rate is on average across the state. So I said, we didn't just do looking at what people are charging as prices in the market. We also started to look at what do we think it costs to provide these services. These are very preliminary numbers. We did a study that was based on some work that was done in 2020. And some of you may have participated in that because there was a great deal of stakeholder input, but it was during the pandemic, but lots of folks helped show what their costs were to the state. Did some calculating of that. We did a little updating of that to account for the considerable inflation that's happened from 2020 until 2022, and got some estimates of what it costs to provide this care across the different ages of kids in different subsidy regions of the state and different types of providers. What we are seeing is that, as expected, costs for providing infant and toddler care far exceed the cost of providing care for preschool and school-age children. In our models that we did in this initial analysis, what we found was that the cost for providing care was not varying as substantially across geographies as the prices that were being charged. What we think we're seeing there is that we have different kinds of markets across the state. In Western Massachusetts, we're seeing a very compressed market where people are able to charge a very narrow band of prices that are, frankly, a little more similar to what the state is paying in the reimbursement rate. And that may be because in those regions, there just simply aren't enough families of higher income that are able to pay higher rates. And so the market doesn't bear those prices. Whereas in contrast, in the Boston metro area, there are a much wider range of prices that providers are being able to charge. So very different markets across the state, but we weren't seeing the same large variation in cost across the state. We're digging into that much more deeply now because there was a little something about that didn't seem quite right. So we're digging into to really understand better the cost variation that really exists across the state. So the narrow cost estimate results really are quite preliminary. I just want to show you a little bit of bringing it all together, what it looks like if we think about these things together, the subsidy rate and the market rate and the narrow cost estimate. And this is Western Massachusetts here. You can see here where the cost is really quite high for these infants and toddlers, but the amount that the market is charging is substantially lower than that, and really a little more in line with what the state is paying as the subsidy rate. So that the subsidy rate is more tracking the price market here, but not really meeting the cost of providing services. In contrast, in Metro Boston, as I said, a much wider range of prices. So the higher end of prices, the 75th percentile of the market rate, is enough to actually cover what we're calculating as the cost, but the subsidy rate is well below what the market at the higher end is able to bear. I'm throwing a lot of stuff at you here, a lot of complex ideas about the childcare market, but it really comes down to this. That is that you can't fix a market failure like this. What we're seeing in particularly in Western Massachusetts, where providers are simply not able to charge enough to cover what we really believe is the cost of providing those services. You can't fix that just by raising the subsidy rates. Most providers don't serve only subsidized children, and they're mixed in with the folks that are charging at the market prices. And so we have to think about different strategies, multiple strategies for getting resources to providers, to provide them enough resources to be able to pay higher salaries, all of that. So the state is looking at this and really trying to understand. We're helping them to think through ways that they can approach financing the system that will support providers across the board, but also make it easier for providers to participate in the subsidy system so that they ensure that families have access to the services that they need. So again, throwing a lot at you there, but I'm happy to answer questions, but I'm going to stop for now and turn it back to Mars so you can.
Thank you so much. Yeah, I will just echo what Dr. Holly said, which is that was a lot of information, a lot of complex information. If you have questions, I encourage you to use the Q&A function. We have the chat disabled for now, but we will have some time at the end, so feel free to use the Q&A for your questions. And now I would love to turn it over to someone who has firsthand experience making a decision about if and to what extent to participate in the subsidy system. So I would like to welcome Ms. Dorothy Williams. And Ms. Williams, would you please share your story, including the area in which you live and work, the characteristics of the families you've served, and how your participation in the subsidy system has changed over time? Thank you.
Thank you so much, Amherst. I'm really delighted to be part of this panel this afternoon. I am in Region 6, which is in the Dorchester area, Metro Boston. I have been a provider for, this January, 15 years, but I've been in childcare for over 20. As previously discussed, I'm the president-elect of Macy. I'm also pursuing my PhD in early childhood education. Having said that, when my first 6 years of doing this work, I only accepted vouchers based on the fact that I live in a community where the multiple way in which a parent can pay for services is through a voucher. I would say to you about maybe 5 years ago, I started with private pay, just one or two. And this was on the advice of, believe it or not, my accountant, because each year my family pretty much subsidized my family childcare. So the childcare was not able to make money on its own. So she said, well, why don't you mix the type of children you're accepting into your program? Based on that advice, that's what I began to do. And so now where I am 15 years later, and what I try to do is 50% voucher and 50% private pay. And between the two, I'm able to break even, not make money, but at least break even, which is better than losing money. The issues and concerns I have, and I would love to continue to be with my subsidy children, but again, if you're running a real business, you're supposed to be able to maintain it. So therefore, I'm not able to. The need is great in my particular area. However, when you look at the pandemic and what that has caused, and then now inflation, as far as I'm concerned, the vouchers will never be able to catch up. So I have to take private pay because the private pay makes up for the vouchers. Now, the cost of food, if you're in a food program, the cost or the reimbursement rate for the food program did not go up. Neither did the reimbursement rate for the vouchers. When people come into this business now, most of them are doing private pay based on the fact that they cannot afford the vouchers. My issue and concern for voucher children is being able to provide them with additional support services, a mental health component, That is extremely important right now because a lot of the children are stressed out due to what has happened with the pandemic. And not only the children, families as well. And having additional support services for the families is important as well. So I feel like when I'm taking on a child, I'm not taking on that child, I'm also taking on the family as well. And I try to do everything I can to give them additional supports when they ask, and if I see that it's needed and required with their child. The other issue of concern that I have, to be perfectly honest with you, is that if you're part of a system, systems right now cannot give you referrals. It's not like they have them at the ready because of the wait list for vouchers in the state of Massachusetts. So again, if you're new and you want to come into this business, how do you recruit for families? How do you access that? Where's those types of support services? The state says, well, this is your business, you're independent. So therefore you have to do the recruiting on your own. And I say that we need to really look at that and see whether or not there's something that we could possibly do to change that particular thing, because that's not going to work for us. So I really would love to be able to go back to having 10 children who are under the voucher system, but at this point in time, it's just not affordable.
Thank you so much, Ms. Williams, for sharing that. I think a lot of what you said reflects some of the considerations that Dr. Hawley and Ms. Adams shared. And actually, I would like to now turn it over to the panel for a few questions. So we'll start with you, Ms. Adams, and you feel free to react to anything else you heard, or if I do have a question specifically, which is, did your research reveal anything surprising about how providers are making the decision about moving the dial on the number of children they're serving with subsidy in one direction or the other?
This would not be surprising to Dorothy Williams, but this was surprising to me as a researcher, was I think we think of providers as participating or not participating. And first of all, there's a huge range in the level, but there's also mobility. There are some providers that are in a community where are no private pay families, or very, very few, and they have no choice. They have to go to private, they have to go to subsidy kids. And if there's not enough money in the system, as Dorothy was saying, those kids aren't going to come in, but that's their money, that whatever the rate is what they're going to get. And that means it's shaping the quality, but it also means they're probably in a very low priced area. So it means that the money might be concentrated and stuck, and the providers are most vulnerable to inadequate rates in the places where the quality is already most challenged. Whereas there's a whole bunch of providers, like Ms. Williams was talking about, that, if the system doesn't work and they can find private pay parents, they move out. There's a recession and the private pay parents aren't there, they move in. I mean, it's like you change, you say, okay, now I don't have private pay parents coming in, the pandemic came in, so I'm going to go, whatever it is. But I think it's really important to understand that the folks, I think anyway, but we haven't proven this in research, that move in and out are probably the ones that are providing higher quality care, because they can access more resources from private pay parents to be able to pay their staff more, et cetera, et cetera. So it's really important, I think, to understand which providers are highly reliant, and every sniff or cold that the subsidy system gets is going to shape the care that they can provide versus those that can move out and in, and think through who it is that we're trying to support. We need to be supporting this group, but we also need to be thinking about how do you incentivize more, how do you make sure that Ms. Williams can keep her kids and be serving them, right? So but they're not the same groups of providers.
Really interesting. Thank you so much for that. Dr. Hawley, I think everyone is curious about what we can do to change the dynamic of the current system. And I know you mentioned working with the state a lot. I'm just curious, from your perspective, what is the direction that states need to move in if they want to achieve greater participation in the state subsidy systems and grow their childcare supply?
It's a great question. I think that there's two parts to this. That what we need to be able to build the overall supply of childcare, of which subsidy is a part. So I think that many states are finding a lot of challenges right now with not being able to find staff who are able to come and work in programs, because parents aren't able to pay the cost that would be enough to raise the wages enough to get that stable staff in the program. So there's this getting overall supply in the system, and then within that, how do you make sure that that families are able to access that whole system? And that's where those subsidy rates really come into play. So making sure that there isn't this huge disparity between what you can charge families who are outside of the subsidy system and what you're able to charge families who are within the subsidy system. But just keeping in mind that overall, most parents are not able to pay the full cost of high quality care at the wages that the folks in the programs need to receive to be stably working there.
I see you nodding, Ms. Williams. Thank you, Dr. Hawley. Having heard from your fellow panelists, Ms. Williams, what resonates with you? I mean, you shared what you're considering. What would you say is the biggest barrier you're facing today? And what would you need in order to feel equipped to serve additional children that might come with subsidies?
Knowing that there would be a mental health support services component attached to subsidy children, because I believe that they go through a lot of social and emotional issues and concerns, and not only the children, but the families as well. Also, yes, it would be wonderful to get an additional rate. And I think that the 75% potential, that sounds great, but we know that's not realistic. And the other thing is that when you take a look at how Massachusetts breaks everything down in regions, why does one region get more money than another? I don't quite understand that particular logic. In addition to that, why is it that we find ourselves having to even have this conversation? Number one, since we are, the issues and concerns that I have the most is quality costs money. And if you want to provide quality, you have to spend the money. I've done that. And I think for me, it makes my classroom much cheerful and academically higher. And I think that one of the reasons why I have a wait list. But that's just my particular program. The issue I have is if I'm going to be a person that is going to have subsidies, I want to make sure that I'm giving them my level best. And you cannot do that if you don't have the proper resources. And so it's not just it's not the material things, but it's the social emotional things that are associated and attached to this that need to be taken into consideration. And right now it's not. I guess and the other issue I want to say is that I don't see financially the difference between an infant and a toddler at this point in time. Toddlers eat regular food. And right now the cost of eggs, I'm just simplifying this for you, but all of us go to the grocery store and all of us have felt the impact of inflation. So right now, I just think that they need to really take another look at that based on where we are. There might have been a time when infant care might have cost more than toddler care, but I'm not sure if that's the case right now, to be honest with you. At least it's not in my program. So I would say to you that, some things do constantly need to be reevaluated. But again, quality of care, as we all know, will cost additional funds.
Absolutely. Thank you for sharing that. And there's a couple of technical questions that I wanted to give to the panel just to be addressed. And then I did want to invite you, Gina, to share the comment you put in the chat, because I think it'd be worthwhile for everyone to hear. But there was a question, maybe you can answer this, Dr. Hawley, that came through. Are market prices self-reported or are they documented? And then sort of a follow-up question, which actually Ms. Williams asked, was why is there variation by region in terms of the reimbursement?
Sure. So this year we were able to use a new approach in doing the market rate survey, which is to use administrative data. So some folks put their information in regularly into the resource and referral system, and we were pulling our data directly from there. And as folks applied for their C3 grant, they had to verify that yes, that what the information they had in that system was correct and up to date. So we believe that we got much better data and much wider and more representative data across the whole system, not just among subsidy providers, in our market rate survey this year, which was really exciting.
Thank you. And can you address the question about the variation by region?
It is required by the federal government that you do some kind of looking at various variation by geography in terms of prices. So every state generally does this, break their state down into various regions, and it's sort of up to the state how many different regions. And so the market rate survey itself is broken out into those regions, and you can see that the prices really do vary quite substantially across regions. So that is part of what's driving that, and I think the state is interested in really looking at diving deeper and understanding that better.
Thank you so much. Ms. Adams, Gina, did you want to share what you had written in the chat? I think it would be great for the whole group.
Yeah. Just one thing I wanted to mention about the regional thing that I think Teresa knows much more about than I do, but one of the real questions is, where do you draw those boundaries, right? Because provider being on this side of the line versus that side of the line could be providing the same service, but if they happen to be in a high income, in the boundaries, it's like voting, boundaries. So anyway, it's one of the challenges for everybody. I think is, where do you draw those lines and how, because it has huge implications for providers. So my point that I made in the chat was, and I think this all became very clear with us when we started looking at the idea of having Build Back Better, was as long as we are within the current funding situation, if we raise rates, we will serve less kids. So it does not necessarily result in more children getting served. It results in providers getting the right amount of money for the kids they do serve, which is a completely valuable thing. But this is a trade-off that state administrators, I'm very glad I'm not one. Because how do you make that trade-off? Do you kick some kids off of subsidy to raise the rates or not? So I'm just, without more money, in some ways, we're just rearranging the deck chairs on the Titanic. So I just want to really say that that's got to be the fundamental issue that we deal with.
Thanks. Go ahead.
I wholeheartedly agree, and would say that the understanding the magnitude of how far the resources fall short of the need is helpful. It's like 20 cents on the dollar in most states. I don't know what the exact number is for Massachusetts, but we're enormously underfunded. And so even the influx of resources that we can have is not going to solve this overnight.
Can you just, I think because this is an important point you're both making, and I think it might not be super intuitive. Can you just clarify? So we have, the federal government has a finite amount of money that they contribute to the state, and the state has to choose basically how are they going to set their rates, and that affects how many people are receiving access to financial aid for childcare. Is that essentially what it is?
Yes. They get to choose who's eligible, how much they pay, and how much families have to pay in co-pays. And those are the three policy tools they can choose. And how they mix and match those is going to affect pay more, serve less kids, make parents pay more, serve more kids, lower eligibility levels, serve more of the eligible kids. I mean, there's just not a good win-win-win in this situation.
But if we had, it's fair to say that if there was substantial additional funding, that there would be the potential to serve more kids.
Yes. And what was the concept of Build Back Better was the idea that you put so much money in that in some ways the public funding would become the market. That would be what was driving prices. That would be what was driving what people should get, so that parents weren't, because right now we're just going to always be shaped by what parents can pay. And there's no way parents can ever pay the full cost of quality care unless they're very rich. So as long as we're a private market-based system, we are going to be constrained. If we put enough money in from the public sector to really take that over, that's what would change it, but that's what we thought we were going to try to do, Build Back Better, and it didn't work. So.
Thank you for clarifying that. We only have a couple minutes left, so I just want to first say thank you so much to each of you for being here, for sharing your time and expertise. We have a big challenge in front of us, and I think you've helped us frame it and understand it better today. I just want to give you each the chance to for some final words to close this out. Specifically, we know there's a range of folks on this call, including, state representatives and other providers. And so what is a message that you would like people attending to come away with from this presentation? Why don't we start with you, Ms. Williams? What do you want folks to know, especially the policymakers on the call?
That the quality of care, there's a cost associated with that, and that I feel as though this particular industry needs to be paid with fair and equitable outcomes. And currently that's not the case. And it would be wonderful, and I think it's great that we're having this conversation, because this is a hard fight. I know that it's something that's probably going to have to be addressed long term. There's certainly no easy answers to this, but I think that if everyone is sitting at the table, they would have a greater understanding, like we're doing right now, of how things are done and what the real true mindset is when people make a decision as to whether or not they're going to take a private child or a child who's on a subsidy. And again, I just feel like for me, because of the particular area that I'm in, I would prefer to have all subsidy children, but I cannot because it's just not affordable. I no longer can afford to do that. So it is really wonderful that, again, we're having this type of discussion. And I hope that there could be some increase, that people would open up. I don't know where the money would come from, hopefully from the feds and the state, and they really take a good hard look at how to increase this industry. We have to help everyone work. If we're not working, no one else is.
Well, I don't think anyone could have said it better. Thank you so much, Ms. Williams. And it looks like Dr. Hawley and Ms. Adams are nodding. So I do want to see if you want to add anything to that, but we can end it there if you're all set. Okay, great. Well, thank you everyone so much, to the participants, to the panelists, and for everyone who tuned in. We really appreciate you tuning in for this important conversation, and we look forward to continuing it. Thank you so much.